joining us now, our good friend, becoming a regular on the John Fredericks Show, Dr. Roger Klein. He's an MD, he's a JD, a pathologist, and with a subspecialty certification in molecular genetic pathology. Dr. Klein, welcome back to the John Fredericks Radio Network. Good to have you, sir.
Hi, John. Thank you. It's good to be here.
Dr. Klein, over the weekend you said that the World Health Organization did a disservice to the world by enabling China's lack of transparency about the severity of the SARS outbreak. Can you elaborate on that, Doctor?
Well, I think it's become clear that first of all, China would not allow our people to come in and see what was going on, and we can see now how they're increasing even greater restriction and censorship on information. But I think they came out with original statements, for example, that it wasn't transmissible, and the numbers that they put forth, while they seem large for an 11 million person city, were actually quite small. 80 plus thousand deaths, or 80 plus thousand cases ultimately. And I think all of this is not real. I don't think any of this is reliable. Based on our experience, particularly in New York and around the world, I don't think their numbers are meaningful. But WHO vouched for them. I mean, WHO told the world that China was being upfront.
Tell me, what was their reasoning for doing that, Doctor?
I don't know. I have no idea. It's difficult to understand how a lot of these international bodies function, but they seem to be heavily politicized, and it's sad because it isn't that they don't do good work, and I think they have been helpful even in this outbreak in some cases, but they misled everybody into believing that this situation was better controlled than it was.
Let's get to Dr. Anthony Fauci, Dr. Klein. Shockingly, I've got two things. An article that he co-authored that came out in the New England Journal of Medicine, which was published on March 29th. That was only 15 days ago. He said, and I'm going to put a direct quotation here, the case fatality rate may be considerably under 1%. He said this suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, or 0.1%. This was published on 3/29, so maybe it was written 2 weeks prior to that. 3/15, we'll give him the benefit of the doubt. Let me just ask you this. Yesterday, he gets on CNN, and he said that if the Trump administration acted earlier, they would have saved thousands of lives of Americans. Yet 3 weeks ago, he's authoring an article that suggests the exact opposite. What is up with this guy?
I don't know. I mean, that's one of the reasons I think people have trouble understanding or believing what's coming out of some of these folks, is that the original justification for all of these extreme social distancing measures wasn't to save lives. It was really to spread the deaths out and the illnesses out so the hospitals wouldn't be overwhelmed. It was, in fact, I remember clearly people saying, well, it's not going to really save lives over the long run. It's only going to utilize our hospital resources, our healthcare resources better. And that shifting justification is another reason that to be skeptical and to question.
I just couldn't believe he got on CNN yesterday and blamed the president for people dying. I mean, he blamed Trump for people dying, but 3 weeks ago he said the same thing. How do you, in good conscience, do that, Dr. Klein?
Yeah, so I don't really understand. I didn't hear what he said, and presumably he's blaming himself since he seems to be the point person. But I'm quite frankly, I've got to be honest with you. This is a contagious respiratory virus that appears to have a lot of asymptomatic people who have an ability to spread it. If we look at data that are coming in from places like Germany, where they've done a serology study now in a city, where we can look at Denmark, where they've done a lot of testing, it appears, and the Center for Evidence-Based Medicine at Oxford, which is probably the best in the world, we're looking at a death rate of 0.1 to maybe 0.5%. Germany had 0.39, but I think Center for Evidence-Based Medicine said it was 0.1 to 0.39. So we're really talking about a severe flu, at least from what we know now. That's pretty contagious, and I've got to be candid. I'm not sure what we're going to be able to do over the long run to prevent deaths, although we may be able to spread out some of the pain. I mean, I think people need to be safe and they need to be cautious, and we need to proceed in a common sense way using good hygiene. But we can't do it for flu, and I'm not sure how effective we're going to be. So I think there's reason to question. I mean, we were told last week was going to be complete devastation, and while certainly the deaths that we've seen are tragic, nothing approaching what models have predicted has happened.
Okay, so today, or I guess Sunday, there was a big New York Times article basically blaming the entire pandemic on Trump. No shocker there, Dr. Klein. We knew that was coming. So a big exhaustive analysis on the front page, basically saying it's Trump's fault. He didn't act fast enough. They had people in there saying that there was going to be this pandemic. He didn't take it seriously, and it's his fault that people are dead, and he should be held accountable, right? It's certainly no shocker there. My position now is exactly what you said. We were prepared for this massive week of carnage. Thank God it didn't happen to that extent. But now, to me, Doctor, it's becoming about politics. You live in Connecticut. From District 4, your Congressman Hines comes back to Washington today, and he's calling for President Trump's impeachment again. So now it's become politics. And I'm convinced now you have these governors are not in the blue states are not going to open their economy up because they want the entire national economy to tank, crater, be a disaster so that they can beat Trump in 2020. I mean, I hate to say this, but I don't understand what the other explanation is for what is going on now.
No, I think what it does is it calls into question whether or not what's been going on all along hasn't been directed similarly. It isn't like we're exempt from viral infections. And in 2017, 2018, we've discussed this before. The projections were 46,000 and 95,000 deaths, and we may or may not get there here from the flu. So that those are CDC's estimates, not projections. Estimates for 2017, 2018 from flu, 46,000 to 95,000 deaths. We're not there. We may not get there. We don't panic when we don't drop everything for other causes of death. I understand that this is somewhat scarier, and we've got some high-profile examples of people who are sick, but this attempt to blame a virus on the president, there isn't anything we could have done short of shutting down the borders earlier, and we had no way of knowing to do that. Like Australia, most of their cases, they've had outbreaks based on imported, people bringing it in. They shut their borders down. I mean, New Zealand, I believe this is a similar thing. We could have done that. The president tried to do that. He was chastised for it, called a racist. And I don't understand. To me, it's not only is it wrong. It's silly. Again, we have a contagious respiratory virus. I'm not sure what they expect the president of the United States to do about then they could blame him for the flu. What's he supposed to do about it?
It's unbelievable. We're with Dr. Roger D. Klein, MD, a pathologist with subspecialty certification in molecular genetic pathology. And he's got so many degrees that if I read them on the air, we'd be out of time. So just suffice to say, this guy knows what he's talking about. You put a statement out the other day saying it's time to start to reopen the economy, Dr. Klein. on a targeted basis. Can you elaborate on that?
Yeah. I mean, so what we're seeing, we're not seeing this exponential rise in cases and deaths. I think we're getting an understanding that the death rate is much lower than we had originally believed. We have economic projections that are every bit as reliable as the epidemiologic ones that have directed our policy thus far, that are predicting 20% unemployment. This is we're talking about devastating the financial lives of millions of Americans. So in my view, we have to look at the totality of the circumstances, look at what we have together, and come to a common sense approach to moving forward. We can do it safely. We can do it using protective methods to keep people safe. And we can, look, if people can work at home, sure, let them work at home. But we can look, and grocery stores stay open. We have all sorts of politicization of what is an essential business, marijuana shops, other things, depending on the state you live in. These are allowed to stay open. What we can do is we can protect our workers, we can protect our people. Most important, we can act smartly and not, kind of stay away from other people right now. These sorts of things, keep clean. If you're sick, stay away, and we can do this and we can move forward. We don't need to be paralyzed.
The view now on keeping the economy closed to keep us safe and keep it shuttered, we've got 17 million people have filed for unemployment, Dr. Klein, in the last 2 weeks. I suspect that by the end of April, that number is going to double. So we're going to have 30 to 34 million people on unemployment. There's only 150 million people in the entire workforce. That's over 20% of American workers unemployed. Eventually, your unemployment insurance runs out, right? You can't get $900,000 a week forever. So this eventually runs out. Meantime, thousands and thousands of small businesses a day, which are the engine of the economy, are dying and going under, Dr. Klein, by the hour. And my contention from the beginning is the social economic reality cost of this economic shutdown should be chronicled every day right alongside the number with the viruses. All we do is talk about, this is how many people died, this is how many people are in the hospital, this is how many people are infected. Now we need 1 million tests. We don't talk about the suffering going on the economic end of it. I think that's insane.
I think, you're right. And the problem is that now some of these politicians are going to have to start to consider what's going to happen when we look retrospectively, and that's going to come sooner rather than later as we learn how to manage these patients. Look, this virus is with us. I'm not saying it's going to go away. Hopefully it'll abate over the summer, but we only have a small percentage of the people infected. It's relatively easily transmitted. People don't necessarily have symptoms. Most people don't get sick with it to any significant extent. So I think, that the likelihood is we're going to have to learn to live with it, at least until we get some sort of protective mechanism. But again, it doesn't appear to be anything approaching the virulent killer that it was initially presented to be. So I think that you're exactly right. We need to start balancing or taking a much broader view toward the situation. Mostly we're dealing with fear right now, and in my view, we need to move forward. We can do it safely, we can do it sensibly, and we've got to start going there.
One of the red state governors, whether it be Mississippi, Alabama, Florida, or Texas, is going to open up schools in May. I don't think there's any question. One of them is going to do that. Governor DeSantis in Florida likely to do it. And he said, look, if you want to go by the numbers, there's been 5 people under 25 who have died as a result of the virus, 3 under the age of 18. 2 of those were compromised. So you've really got one person out of, 100 million. He said it doesn't make sense for us to not open the schools. What say, Dr. Klein?
No, I mean, I think an objective look at it is similar, right? You have to, you would draw somebody to a similar conclusion. What you get concerned that the children are going to bring the virus to older people, and I think it's probably important to to continue to try to protect nursing homes, for example, to continue to try to protect elderly people and to keep them away from children is probably a good idea right now. But, this notion of missing an entire semester of setting out, our kids are competing on a worldwide basis now with kids from other countries that have quite advanced and rigorous educations in the pre-college years. And if we remove them from school, a semester is an important period of time, for a young person. I mean, I am sympathetic to that point of view. I think it needs to be done on a state by state basis with a lot of thought, but moving in that direction seems to be the right thing to do. And I still look at Sweden, and now Sweden is getting hammered in the media, but I watch the data every day, and I don't see that they're doing worse than other European countries. Now, how reliable all these data that are reported are, I don't know, but I watch every day, and I Sweden, people are lambasting Sweden, yet I don't see. I'm not seeing the issues that somehow that they're writing about.
Well, Sweden is becoming the control group. Basically, Sweden, the only Western country that has done nothing. I mean, they've done absolutely nothing, and they basically went with the herd mentality approach. And they also said, look, there's going to be a wave, and we're going to ride it out. People will die, but they're going to die no matter what we do. But we're not going to shut the economy down and destroy the Swedish way of life. So they kept everything open. Nothing has changed. And their numbers right now are on a par with everybody else. It's the same.
Yeah, or better. I mean, I don't see that they're rising faster, but I look at, of course, they're way better than Spain and Italy. We look at deaths per million. Sweden is 89. Spain is 374. Italy is 329, Belgium 337, the Netherlands are 160, UK is 145, Switzerland's 129. These are, and those may have gone up a little, but this is we're at the U.S. we're at 67, Sweden's at 89, and we've completely closed down our economy. So I mean, my question, the question really is there justification for what we're doing? There certainly aren't empiric data. They want all kinds of studies and data for hydroxychloroquine, which, is in most people probably going to be quite safe and benign to take. But yet for billions of people, no data are asked for, no studies. You look at, there are some what they call meta-analysis that combine a bunch of studies, and they don't show for influenza that social distancing, and that's a broad term, but they don't show they don't have evidence to support it actually working. I mean, we really don't know that you can stave off much in the way of infections and death, and we certainly don't know that protecting those most vulnerable wouldn't work just as well at preventing deaths, or almost as well as shutting down and locking down the entire nation.
Here's what we do know. Trump is up for re-election in November. Here's what we know. Trump's basis for re-election has been the economy. Here's what we know. Shutting it down has put so far about 17 million people out of work. Probably by the end of April, that number will double to over 30 million people out of work. Here's what we know. Across the country, already over 1 million small businesses have filed or are about to file for bankruptcy. This is all data that we know, right? I mean, these are all metrics that are out there. And so my position is, again, the economy was shut down, and we were told we had to shut down the greatest economy in the history of the world because we didn't want to run out of beds. We didn't want to run out of ventilators. We didn't want to overrun our healthcare system. Americans didn't want doctors to have to choose one person over the other like doctors did on the Civil War battlefield. We didn't want that to happen. So we went with it. Now, nobody's getting overrun. There's millions of beds empty all over the place. And now we're moving the goalposts and saying, we'll keep the economy shut down because too many people are dying. And then now that number's going down, it's like, well, we have to keep the economy shut down until we can test 300 million people. So now to me, it's about politics and beating Trump. And I want somebody to come on my show and tell me that I'm off base and tell me why. Nobody's been able to do that.
Yeah, I mean, I think that there's good reason to believe exactly what you're saying, because there are people, honest people out there who are actually acknowledging this. So I think that the job of a president and of a leader, and the job of our politicians right now, is to really try to ignore that and to do what appears to be the sensible thing, not what the doctor, what a government bureaucrat doctor says, or not what I say. What to look at and synthesize these opinions, and look at the totality of the circumstances and move forward in the way that their best judgment tells them to do. And I have confidence that the president's going to do that.
All right, we're out of time. I want to thank Dr. Roger D. Klein for being with us. Always great to have you on, Dr. Klein. Thank you for your time.
Thank you.